Hey guys, Dr. Bonnie here.
And Lisa.
Today on this weekly wellness, we are going to talk about the Webster Technique. So what is the Webster Technique?
So the Webster Technique is a specific chiroanalysis and adjustment. It helps reduce interference to the nervous system and it helps balance your pelvic muscles and ligaments. It's going to reduce any torsion in your uterus and allow for preparation for birth by giving optimal fetal position. So basically the Webster does consist of two parts. What are those two parts?
So the two parts when it comes down to the Webster Technique is to correct the pelvic misalignment, but also to apply trigger points to help release the round ligament or the muscles in the rectus abdominis. So today we're going to go through exactly and perform what it means to actually get this technique.
In our clinic, we do have pregnancy pillows, so this is just going to make it more comfortable and ease your way into the adjustment for any expecting mothers.
For the first part of this adjustment, you want to have the patient lay face down. So Lisa, you can go ahead and lay face down for me. Alright, once the patient is face down, what you want to do then is go ahead and bring their legs on up. You are checking for the side that has the most greater resistance. So you gotta go ahead and flex one and then flex the other. From there, the one that has the most greater resistance, which is her left side, is gonna have the posterior rotation of that sacrum. So I'm gonna go ahead and do is first stretch out her L5 and her sacrum to allow that disc space to get pressure off of those nerves. You kind of stretch it out, and then you're gonna go ahead and adjust that sacrum. So what you're gonna do here is you're gonna feel the table come on up, Lisa. So here it goes up, and it's just a small amount of thrust that you put into this adjustment to get that sacrum back in place. So here you're gonna hold and down, just like that. The last part of the Webster Technique is you're gonna have the patient go face up, because this is when you're gonna actually apply their trigger point and find the spot. So what is the spot? It is the rectus abdominis on the round ligament. So what you'll do is just apply a small amount of pressure onto the ligament to go ahead and contact the spot. So for here, Lisa will be right here. And then you're just gonna hold it until you feel a release. And there's when you feel that release, then you go ahead and unapply that pressure. And that is the Webster Technique.
So in the next 20 to 30 minutes, you can expect to feel the most amount of movement.
Yes, and also too, for that first time you do the Webster Technique, it is normal not to feel a good amount of movement due to when it comes to technique, you want 4 to 6 sessions in order to have that optimal fetal position for that baby.
So Dr. Webster does say that there is a 97% success rate. So that just means that the baby is in optimal position for birth.
Now, if you guys have any questions, let us know. We appreciate taking care of all the moms in our office and creating healthy families, and just can't wait to be able to serve you guys.